Hey, what's up, guys? Today we're going to go over our exposure procedure. So this is out of our COVID-19 EMS Response Guide. This is what our agency is following. It may or may not align with what your agency is doing for post-exposure. So make sure that you check with your designated infection control officer or supervisors or your agency admin to make sure that this matches up. If not, don't follow it. Follow your own protocols. Also, if you're watching this, it is probably outdated because this stuff changes almost daily. So you should go to the website. It's bit.ly/COVIDEMS, or you can hold your smartphone up to the little QR code there, and that's going to pop up a link to the most current version of this document. All right, so this is what our supervisors, our infection control officer, our medical directors are using as kind of an initial screening tool to determine what to do if someone thinks there may have been an exposure to a patient that may have COVID-19. So we talked about on the very first page of this document what would constitute a possible exposure. So this digs a little more into it and more goes into like what we should do about that. So first off, if there is any doubt you think there might have been an exposure, the person should put a mask on, wash their hands, and isolate themselves. This may seem like a little overboard, and it probably is, but it's not just to protect that person, but also others. So if we think they got exposed, we want to put a mask on them just to kind of protect that for anything else. Wash their hands. They should have done that anyway, but hopefully they will do that. Hopefully they were already wearing a mask, in which case the chances of exposure are actually a lot less. But isolate themselves. This is not because you're going to come in contact with a patient and magically just become infectious yourself. Okay, that doesn't happen. Typically, like right now, they're looking at about a 3-day window before you would actually start shedding that virus yourself or become infectious. So that varies a little bit person to person, but in general, you've got a little bit of time here, a couple days at least. So really, this is more just to protect you as someone who's been exposed, or if you're the supervisor following up on this, it's just to protect your people. So they should already be wearing a mask, but if not, make sure that they do. Wash their hands, decon themselves, and isolate themselves away from others, just so that they don't, if they have something on them, they're not sharing that or spreading that to somebody else or other providers. Then we're going to evaluate some simple exposure stuff using this guide. So this is kind of the quick down and dirty version of it, but also there are going to be little nuances, of course. So that's why you still want to let your supervisor or your infection control person know, and they may have to modify these a little bit depending on the current recommendations. So that said, after all of this is said and done, you still definitely need to be contacting your supervisor. So if you are the person who is exposed, make sure that you are contacting the supervisor. Make sure you're contacting the infection control person for your agency. All right, so evaluating the risk of exposures. All right, so this is a matrix that varies a lot depending on PPE. All right, so on the very left there, that column is the provider. So what the provider is or is not using as far as PPE. And then along the top, that's the patient. So if the provider is not wearing a mask, we're in the very top left here, the provider is not wearing a mask, and the patient gets fluids or coughs on that provider, that is a high-risk situation, medium to high-risk situation, and we really want to get that source patient tested. So the sick person, we want to get tested. If the provider was not wearing a mask and the patient was not wearing a mask, and they were in close direct contact for an extended period of time, that is medium to high risk, and again, we want to get the source patient tested. If the provider is not wearing a mask and the patient was wearing a mask, that is still a medium to high risk exposure, and we want to get that source tested. So if you notice a trend here along that top line, if you as the provider are not wearing a mask and you come in contact with someone who has potentially has COVID-19, that is always going to be a medium to high risk if you were in that close contact. So like within 6 to 8 feet for any extended length of time, that is a medium to high risk. And we are going to want to get that person tested and, deal with the post-exposure stuff for you as well. So if you're not wearing a mask, you're pretty much stuck in that medium to high risk category no matter what happens. All right. So the next one down, you are wearing a mask. So you as the provider are wearing a mask, but you're not wearing any goggles or significant eye protection. All right, so if you are not wearing a mask, or you are wearing a mask but no goggles, so nothing protecting your eyes, and the person coughs or gets fluids on you, that's still a higher or a medium risk, and we want to get them tested. Or if they're not wearing a mask, even them talking, the particles could come out and get on you. If you are not wearing eye protection, then that is not good. So make sure that you are wearing goggles and a mask, and that's kind of the easiest way to protect yourself. If you were wearing a mask but no eye pro, and the patient put on a mask, that's a low risk because now the mask that they're wearing is preventing those droplets and particles from coming out onto you, and you're wearing a mask so you're not breathing any of that in. Then that does drop you to that low risk. But we really still want to avoid that, so we want to be wearing goggles or some kind of approved eye protection. And that, if we're doing both of those things, that drops us into this bottom tier here, which even if you have somebody that coughs or gets fluids on you, if you're wearing a mask and goggles, then you are considered in a low risk. And other than general decon, and now if they got fluids or coughed on you, you're probably going to want to change and shower. But otherwise, that's still low risk. So if you were wearing a mask and goggles and you properly decontaminated yourself, you're good. If you are wearing a mask and goggles and the patient does not have a mask on, that's still okay. We still want to give them a mask because that's going to lower the risk even more. But as long as you're wearing your mask and goggles, you're good. That's low risk. And as long as they're not coughing or getting fluids on you, you don't need to do anything else. And same if they have a mask and they put the mask on, again, they're good to go. So we don't need to do anything. So the safest option of all is you as the provider are wearing a mask and goggles and the patient is wearing a mask. If we do that, we're in really good shape, and we are going to stay down at the bottom right of this matrix. All right, so what happens when we do have a medium or high risk? All right, so first off is decon, and that may involve shower and change. So especially anytime you get fluids, cough, anything on you, then you're going to want to change and shower. Now, if you're wearing a gown, then you may not need to do that, but that's going to depend on the protective equipment that you're wearing and where that contact was. So if they, sneeze on your gown, then obviously that gown needs to go away, but the gown is intended to protect you from that. So just make sure you're wearing the appropriate PPE and that won't be an issue. Next, you want to make sure that you inform your designated infection control officer. So for your agency, whoever that is, you might have someone specifically designated that, or maybe it's somebody that's kind of does multiple jobs. Maybe it's one of your medical directors, maybe it's the health department, whoever it is for your agency, just make sure you know to get a hold of that person. And we want to get the source tested. So testing you right now isn't going to do anything. Even if you did have an exposure, even if you had an exposure and the person actually did have COVID-19, that initial test isn't really going to tell you anything. So what we want to do is get the source tested, because if we can get them tested, that might mean the difference between you having to sit at home and not work or not go in for duty for 14 days versus just a couple days until we get those results back. So how long those tests take, it kind of varies depending on where you are, what lab is doing them, and what kind of test. There are some quicker, rapid options that are coming out now. So hopefully we can get that test back pretty quick. And then the last thing that we want to do if we have a medium or high risk area exposure is to go home and self-monitor. Now, realistically, the time between when you've had an exposure and when you could potentially become infectious, it's actually several days. They're thinking right now about 3 days. So you're not just automatically going to become infectious the second somebody sneezes on you, But you're going to want to go home so that you can really fully decon and shower, and we don't want to really risk putting other people in there with you. So some systems are actually shifting to where they'll keep you in service after you've deconned for a couple days, pending the result of that source test. But right now, for our region, we're still saying that you should go ahead and go home and self-monitor until we can get the results back. So that's going to be our best bet for that. And that just minimizes the risk to everybody else. What is involved with that? So the go home and monitor, in general, everything's still going to probably be fine for you. So the risk is still relatively low, especially if you used appropriate protective equipment, you're washing your hands, you're taking precautions. Basically, you're going to be off until we either get the results of that source patient or 2 weeks. So if they didn't test the source patient, then and we don't have a way of getting that information back, then you're probably going to be down for the full 14 days while we make sure that you don't actually become positive and don't have any symptoms develop. So that's kind of the two options there. You're either going to be down until we get the source test back, which hopefully we did, or if not, then we're going to shift and do a full 2 week isolation, kind of self-monitoring, just to make sure that you don't get sick. Chances are you're not going to, but we don't want to take any risks for our patients or our other providers. So that's kind of where we're at with that. I know some places they're kind of a little worried about the availability of tests. I know at least locally, providers and healthcare workers and first responders, that is a priority as far as testing, even if it's the source patient. So, testing in and of itself is not really a big deal because it's not going to change much or dictate treatment. So for the actual person who is sick, the testing is almost irrelevant. It's really more of a thing for the epidemiologist that they like to be able to track all this stuff. But really the big benefit in testing for first responders is that we know whether or not you have to sit out for a longer period of time. So because of that, testing of source patients for exposures for first responders is actually a pretty high priority on that list. So somebody that may otherwise not need to be tested because they don't meet any of the other risk factors or criteria, they may still get tested just so that we can rule that out for you so that you can get back in service quicker. And so during that time, obviously, if you develop a fever, cough, or any other symptoms, make sure you check in with your primary care doctor. They're probably going to tell you to stay at home and isolate because that's kind of the general recommendation right now anyway. They don't, even as a provider, they're not going to recommend that you go into the hospital or get tested right now because that's not going to change anything. That's not going to change the treatment or the care or what they do or anything. So that'll probably be what they'll recommend, but you can check in with them and then definitely let your agency know. So your designated infection control person, your supervisor, whoever you need to call, make sure that they know that so they can factor that in as far as time-wise for you to come back. And also that might factor in for like workers' comp or any other assistance with, coverage for any treatment that you may wind up needing in the future. So definitely report that. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.